Well, midwives have slammed Health New Zealand over the collapse of Whakatane's hospital obstetrics services, saying a lack of action is to blame. From next week, pregnant women in the Eastern Bay of Plenty will have to travel further for specialised help, with the knock-on effect to be felt around the country. Bay of Plenty reporter Jordan Rudd has more.
Kat Walsh doesn't take moments like these for granted.
Go play!
6 years ago, her son's birth didn't go to plan.
I was in labour for hours. I was in pain, I was stressed, I was hormonal, we were worried about the baby.
He was born via emergency caesarean at Whakatane Hospital, but from next Thursday, that won't be an option here for mums-to-be, with no local obstetricians left.
Everyone has got a story about a birth that went wrong, or a time when intervention was needed, or things just didn't go to plan.
The hospital is now becoming a primary birthing service, which means those with an increased chance of needing birth intervention or complications mid-labour have to go to Tauranga Hospital, at least an hour and a half's drive away.
It's a huge blow to our whānau, and it'll have severe implications for how they choose to birth.
Te Whatu Ora says the change is temporary as it tries to recruit.
This has been an ongoing issue, which we feel that Te Whatu Ora has not kept on top of. They also haven't really had the foresight and made a plan. So really they are choosing to close the unit down.
We see this as a service disruption that could have been avoided, and it's very frustrating.
In a statement, Health NZ told One News the decision was carefully considered and necessary to maintain safe and quality care.
We've been given assurances that they're doing their utmost to refill those positions, and this is not going to be a downgrade, and they will restore the service, but that remains to be seen.
Concerns extending beyond the Bay of Plenty.
If Tauranga potentially becomes full and is at capacity, then whānau are having to helicopter to Waikato, and then the same with Waikato, having to helicopter then down to Wellington.
Kat has started a petition calling for a rethink.
This is a situation that they have brought about by mismanagement of their staff in the unit, and that it's the community that's paying for it.
Holding on to hope, their shared concerns will be heard. Jordan Rudd, One News.